What's up, guys? Nurse Ninjas here, bringing you another medical mystery. Today in our dojo, the GNMH hospital, we had a nosocomial outbreak in 11 patients. I know, crazy. We have a special guest today who came face to face with this deadly outbreak. We have multiple special guests. All right. The more the better. We got Finn, Filberta, and Fiona. All right, now, Bree, let's dive into the juicy details. What do we got?
Recently, we were notified of an outbreak in the GNMH hospital. There were 11 patients who contracted the infection during their stay at the hospital. Most patients had symptoms similar to severe chest congestion, cough, and difficulty breathing. At first look, the connecting link between all the patients was that they were put on an IV saline drip. And through an isolation and gram staining process, it was found that the bacteria causing the infection was Staphylococcus aureus.
All right, coming at us first, we got Finn. What you got for me?
I was in the Garcia Newgard Medical Hospital for a knee replacement, and I was staying in the hospital for 7 to 10 days. My surgery went well, and I was on the way to recovery. When on the 5th day, I developed a red rash at the site of my cut that was white. It had pus-filled pimples within it. It was warm to the touch, it itched, and it was very painful.
Thanks, Finn. Love to hear your story. Next, we're going to hear from Filberta. What you got for us?
Thanks, baby. Let me tell y'all something. When I was 20, I saw my life flash before my eyes in that there car crash, and it really messed up my back. I originally came in for laminectomy, or whatever the hell you call it, to allow my nerves to have more room to move around and make it easier on me to walk. Thank God. I received that good old muscle relaxer with some typical anesthesia. Don't get me started on whatever was in that darn saline.
Appreciate that, Filberta. All right, next up we got Fiona. What you got?
Thanks, hon. My name's Fiona, and I originally went to the doctor because my tibial fracture. However, shortly after, I went to get developing a rash of pimples near my fracture. Don't even get me started on the green, oozing, slimy, juicy pus. Don't forget how fruity it smelled. Like a pack of Welch's. Anywho, the doctor said that any time they made an incision, there was a layer of pus that oozed out of the cut. They said it was like a cavern full of stalagmites, but the stalagmites were dripping thick, viscous pus. Did I mention how fruity it was? Anyways, thanks for the interview.
Thank you, Fiona. Thank you. All right, next up we're going to look at the procedure into discovering what all happened.
Through a careful and extensive process of looking through hospital staff schedules, enemy therapy visits, and equipment logs, it was found that the patients contracted the infection from a contaminated batch of saline solution. The 11 patients residing in either OR-Bay or OR-B or oncology all received the same saline batch under lot number 7441. Also, since the patients in the oncology room came into contact with different hospital staff, it dismisses the idea of it being spread by hospital staff contact. Because of Staphylococcus aureus' high salt tolerance, it can live under saline solution. It is recommended to prevent further contamination by removing and replacing the current contaminated saline batch, along with the antiseptic wipes in case of the superbug variant MSSA. Based off of the gram staining results being gram-positive, it is recommended treatment to prescribe gram-positive general antibiotics.
Quality. Love to hear it. Patients, overall, we're just going to talk about the takeaways here that happened. So the patients that had similar symptoms, they included a severe cough and wheeze. And also, just if the patient had a surgery, they developed a rash or skin irritation at their wound site. This is very common in the case of nosocomial infections. Another one, all patients develop symptoms within a 5 to 7 day range after being in the hospital. All patients received saline IV as part of their medications, and the majority were taking pain relievers. This is all we got.